viewers. My name is Edith Wamboy. Today I'm going to take you through a diet of a dialysis patient. What is dialysis? Dialysis is a process whereby we use dialyzer, which is artificial kidney, to filter waste product from the blood. When your kidneys fail, it's not able to excrete the waste product in your blood, and hence it makes you feel sick and you are declared to be a dialysis patient. As we understand dialysis, you'll be attending at least twice a week, so you have to be very careful how you eat. You have to change your lifestyle and to change your diet, because if you understand, your kidneys work 24/7 non-stop, but dialysis will be able to attend 2 sessions a week, 4 hours each and every session. So if you attend session like today, you'll attend another session 3 to 4 days. So you have to be very careful not to overload your body with things like phosphorus, sodium, potassium, and liquid, because you'll be going backwards. Dialysis will not help you as such, because as you attend today's session, by the time you attend another one, you may have even added more waste than the way you had previously. That's why I'm going to take you through a diet of a dialysis patient, so as you can understand how you're supposed to eat. First, there are things that you have to limit, that is phosphorus, sodium, potassium, and liquids. Because how well you recover or you feel, it will depend with the way you take your medicine, attending dialysis, and also changing your diet. Taking medicine as prescribed will help you to feel good, and you'll be able to go on with your daily duties as a normal person without feeling like nausea, vomiting, having edema, that is accumulation of water in your body. We start with liquid. We say that you are supposed to take at least 1 liter of water per day. When we say about 1 liter, we count the tea you'll take, porridge, any liquid that in a room temperature is liquid. That's why we limit to plain water. You'll take 1 glass per day. That is half in the morning as you're taking your medication, and half glass in the evening as you take your medicine. You're not supposed to take any other type of plain water, because you'll take tea, you'll take porridge, you'll take food which has soup. So that's why we limit water. If you take a lot of water, your face or your body is becoming puffy. We call it edema. It can affect your legs, your heart, and even the whole body. You add your weight, and you tend to have many complications. That's why we advise that you take water and all liquids as required. Secondly, we go to sodium. When you take a lot of sodium in your body will tend to retain a lot of water. And your kidneys are not working, so it will not be able to excrete excess sodium in your body. You'll end up complicating and having a lot of water, which we don't want in our case. Reducing sodium, it's not only the salt that we take. We encourage one to put a little salt when cooking. You avoid table salt, processed meat like sausages, bacon, things like ribs, and also canned beef, because they use sodium as a preservative. So you are supposed to avoid those processed meat. The salt intake or the sodium intake, you are not supposed to take more than 2,300 milligrams. When you are able to achieve this, your recovery will be quick. You'll be able to feel good, unlike when you eat it the way you want. We also limit phosphorus. We also reduce phosphorus. As you know, if you take a lot of phosphorus, it will tend to weaken your bones. Your bones becomes weak, and you are at risk of getting fractures. That's why we limit things which are high in phosphorus, like milk. Milk, you are supposed to take half a cup per day. Half a cup. If you're taking tea, meaning tea, if you take 2 cups in the morning and in the evening, it's equal to half a cup of milk, because we don't want your bones to be weak. Milk and also milk products, things like yogurt, cheese, greens, ricotta cheese, all those you're not supposed to take more than required. Also, dried nuts and whole grains has phosphorus. That is like beans, whole grains, peanuts, whole grains like ugari. If you are taking ugari, we change to white, not the brown one, the whole grain. If it's rice, we advise you to take white rice, irrespective of whether you have diabetes or not. Remember, if you had diabetes earlier, we say that you are supposed to take brown and processed meal like brown bread, brown rice, and also whole grain, brown ugari. But in this case, we disregard diabetes diet and we change to the processed one, not whole grain but refined, because if you take whole grain, it will have a lot of phosphorus, and that's what we are discouraging. We also reduce potassium. Potassium is found in fruits, mostly in fruits and vegetables. There are those fruits which are very high in potassium, like avocado and banana. The two fruits you're not supposed to take because the potassium level will hike because of the high concentration of potassium in those two fruits. So you are supposed to eliminate them. You also remit or avoid completely fruits like kiwi, oranges, prunes, raisin, melon. Remember also melon, it's high in water. If you take a big portion of melon, you'll be increasing your fluid intake. That's why we discourage taking melon. Fruits that you are supposed to eat, it's like apple, berries. There are many types of berries. We have blueberries, red berries. You can take grapes, peach. You can take papaya, pineapple, or tangerine. If you are diabetes, remember also you are not supposed to take a lot. You have to take a small portion. If it's apple, go for green one because it has less concentration of sugar. You are not supposed to take the whole of it. Take just a half. And also spacing between meal and fruit. Remember also you are controlling your sugar level. If you take meal, don't take fruit immediately. Before or after, you have to space with 2 to 3 hours. Remember the portion that you have taken of starch. It have risen your sugar level. So if you add like an apple full of it, your sugar level will go up. So you have to space either before or after 2 to 3 hours, so as we can be able also to control your sugar levels. There are also other things which are high in potassium. Avoid all roots, that is arrowroot, potatoes, carrots, yams, cassava. There are vegetables which are also high in potassium, like sukuma wiki, spinach. Vegetables, we are not supposed to boil them. As you prepare, you wash them, cut them in pieces, soak them in hot water, not boiling. Note that. It's not boiling because we want to retain the nutrients in the vegetables. We also remember to put your tomato in hot water because it also has sodium. When you soak them in hot water, the concentration of sodium will be attached on the outer skin. So you remove the peels. There are those which has raw potassium like broccoli, cabbage, cauliflower, and eggplant. You can use them instead of using the others. If you have to use sukuma wiki, if you have to use spinach, remember to soak them for 30 minutes. You remove and then you fry. At the point that one is declared to have kidney failure, most of the times the patient is weak and he or she is not able to do things for him or herself. In this case, we like including caregivers, that is the relatives and those who are surrounding the patient, because the recovery process will depend on them. At this point, you'll see that they are the one who are cooking for the patient. So we tend to educate those caregivers. We give them information and we advise them on the importance of adhering to diet Because if they don't understand why we are saying you soak sukuma wiki or you don't take certain types of food, they will not do it. And the process of recovery or feeling good will tend to be slow and it will take time. And as a result, we can also lose the patient. That's why we include relatives and caregivers to educate them so as they can know the importance of changing the diet and the reason as to why we are prescribing or we are changing the diet, so as they can understand and we can hold hands together to help the patient recover. When the patient is having nausea, vomiting and loss of appetite, we encourage the patient to take small portions of meal frequently, not to give the whole portion at once. As we understand, if you are going through hemodialysis, there are some times that we give supplements if need be. There are two types of kidney failure. We have acute and we have chronic. Most of the cases in acute kidney failure, they are caused by holding urine for a long time without emptying your bladder. It tends to flowing back to the kidney, injuring your kidneys. There is also chronic, which are secondary to hypertension and diabetes. You're also supposed to take a lot of water, so as you know, the work of the kidney is to filter the waste product in your body. As they filter, they remain in the kidney waiting for you to take water, because the water will carry the waste product and you will urinate. If you are well hydrated, you urinate clear urine. So it's good to take a lot of water to avoid complications of your body. Relatives and friends who are having a patient in the ward, they have a big role to play. It's not just coming and seeing your patient. How you react to that patient, the words that you talk to a patient should be words to encourage the patient. It will help in recovery. But if you go and talk negatively about the progression of the patient, you are killing that patient. He or she will not be able to accept and to believe that he'll be able to recover and walk out of that hospital. So, relatives and friends, as you visit patient in the hospital, remember you have a role to play, to encourage that patient, to pray for the patient, to encourage and to help him or her believe that she or he will be able to recover and walk out of the hospital. Once the doctor passes the message to you that you have kidney failure, you have to take it. In this world, you have to believe that anything can happen at any time. So you are supposed to take the message. I know it's not easy, but you have to take the message positively. And that's why you have friends and relatives to support you, to tell you it's possible, to walk with you through the journey of dialysis, because there are many patients who have different kind of diseases. One person, like 5 major chronic illness, and they are standing strong, because we have seen those who take it positively and know that it has happened, there's nothing I can do. They take it positively, they attend dialysis, they change their diet and their lifestyle. We see them recovering. You cannot even notice that they are suffering, because they believe in themselves, they accept, and they move on. So it's not a death sentence. As you do all those things, you'll be able to live a normal life. I'm talking to those who are healthy. It's good you take your life seriously. Take time to go for checkups. If you feel there is a problem in your body, don't ignore. Remember, those who have cars, they usually take them for service, but you don't have time to exercise, to eat healthy, or even to have enough sleep. As you know, if you neglect your body, you'll end up having chronic illness. So it's good to exercise, eat healthy, and go for medical checkup. If you notice you have any problem in your body, please go for checkup. It's also good to work on your weight. Make sure that you are within the normal BMI. You take a lot of vegetables. You take a lot of water. Thank you for listening. I was your host, Edith Wamboi. You can reach me on my Facebook page, Edith Jadhi Maina. Thank you.